Today I'm going to be doing a cardiac assessment. I'm going to start with my patient's head of the bed at 30 degrees. And first I'm going to measure for JVP. So I'm just going to have him turn his head to the left, note the venous pulsation, and then measure at the sternal notch with my ruler. And note that it's about 1.5 centimeters, which is normal. And next I'm just going to assess the carotid arteries. I'm going to listen with the bell of my stethoscope for a bruit. And no bruits are noted, so I'm just going to palpate. And the carotid arteries are both 2+ and normal. Next, we're just going to note the important landmarks. Aortic valve is going to be right sternal border, second intercostal space. Pulmonic valve will be left sternal border, second intercostal space. Tricuspid valve will be left sternal border, fifth intercostal space. And then mitral valve will be fifth intercostal space, left sternal border, midclavicular line. And that's also the apex of the heart. So I'm just going to palpate for heaves and lifts to make sure my fingers don't come off the chest. No heaves or lifts noted. I'm going to use the ball of my hand to measure for thrills. No thrills noted. And then I'm just going to assess the PMI. The patient's going to lay in the left lateral decubitus position. And I'm just going to palpate. His PMI is fifth intercostal space, midclavicular line. It's normal tapping sensation, about 1 centimeter, and it lasts about half of systole. Now I'm just gonna listen in all areas with the bell and the diaphragm of my stethoscope, starting with the diaphragm. I'm just noting that S1 and S2 sounds are present and there's no S3 or S4 or murmurs noted. Next, I'm just going to listen for the PMI. So I'm just going to have the patient return to the left lateral decubitus position. Just going to listen. Normal sounding. Then I'm just going to have my patient sit up. And I'm going to listen down the left sternal border while he's exhaling with both my diaphragm and bell.